In January of 2011, I went in for a routine hearing exam. It was a new doctor, so I had to fill out some paperwork, and I was asked if I had a hoarse voice, and I did. And I'd had it for several months, but I thought, it was winter, overheated rooms. I talk a lot, so I thought nothing of it. But the doctor did, because when he looked at my throat, he diagnosed me with acid reflux and said there was something on my right vocal cord, and that's why I had this hoarse voice. He looked at it and he made an appointment for me to go to the main campus of the hospital so I could see what he saw. Luckily, because, and I think this is the hardest part of being a patient, is the wait. So I went to see him on a Monday. He said, I can remove this from your vocal cord. Your voice will be back to normal. At the same time, I'd like to biopsy it just to make sure. So luckily, that was a Monday. Wednesday, I had the surgery, which was good for me because I'm a worrywart, and gave me less time to worry. After it was done, he'd prescribed medication for my acid reflux and thought everything was fine. And a week later, said, you have cancer. And I'll never forget this. I said, oh, no. We have heart attacks. We don't get cancer. And, no, you have it. It's stage 1A. We'll discuss treatment options at a later date. And this where the patient's imagination runs wild. He was able, when I saw him Thursday at the local clinic, was able to schedule blood work and a CT scan. I'd never had a scan before. It was at the very end of the day. I was escorted into the room. The scan was done. The escort was back again, but the tech was gone. So from that minute on, I was sure that I had lung cancer, that the tech didn't want to see me because felt so bad for this patient because, her future was not bright. So of course, I didn't say anything to anyone. I worried about that. And finally, when my doctor's office called to schedule the tumor board, I said, is the doc there? I think I need to talk to him and ask the question. I said, you could tell me, do I have lung cancer? And he couldn't believe I was asking the question. I didn't realize at the time he had the procedure, he squeezed, he used up some favors. I was seeing the very, very end of the day. Of course the tech was gone because she should have been gone 45 minutes earlier. So at that point I learned if I had any doubts or any questions, ask, because your imagination runs wild, especially if it's something that you never expected to happen to you. I was going to Mexico the next day, went away for 2 weeks. It was a good experience because a friend who I see in Mexico had radiation treatment, so I was able to talk to someone because you don't know what to expect. And the best people to talk to are the people who've gone through the same experience. But once I got back, I was more than ready. I was ready to go. It was the best because you can read about it, but you don't know what to expect. And I was amazed at the technology because of course they had to make a mask. And I guess once upon a time it was really quite an elaborate procedure. It was just done in a matter of minutes. Then I have a tattoo. I'm not a millennial, but I do have a little tattoo. But it was good because I think, and the more information that you have, I think it better prepares you. But again, I learned from the health professionals, but also when I went for radiation, I learned from the people in the waiting room. All the information I think was better. I don't like to be blindsided. I like to know what's going to happen. Learn as much as possible. There's a wealth of information on the internet. Go to reputable sites. Ask questions. Don't let your imagination run wild. You are a health care consumer. So again, if you have any if you're not quite sure, what are they telling me? What are these doctors saying to me? I want to make sure that I understand. So have questions, have someone with you. Sometimes I think it's selective hearing that we don't hear everything in it, or maybe aren't quite sure what we've heard. So to have someone with you and to say, is that what they said? Is that what they meant? I think that's important. Do not think you can skip any radiation treatment days. Just go. Do what you need to. If you want to keep a calendar and mark off every day with a big X or a happy face or something, and it's time limited. It's not always fun. Try to connect with, I developed a rapport with the techs who would set me up for treatment. Just try to make it as personal as possible. And again, during treatment, if you have any questions, ask. You are the healthcare consumer. And if you don't understand why, ask. And I was told that there would be a certain discomfort eventually. Eventually, my neck became very red because it was killing healthy cells as well as the cancer. I was told to be very careful because it was almost gardening season, the weather was getting nicer. Just be careful, always wear a scarf or put suntan lotion on. So I was aware of what was happening to me physically on the outside. And that's one thing that I would always say to people, if your voice is hoarse, don't just see someone. Have someone look at your throat, because you never know. Had I not gone in for this hearing test, and I wasn't in any pain. I just was hoarse. I didn't think anything of it. So that's been, whenever I talk to people about what happened to me, I always say that. Just, have someone look at it. I mean, my doctor, my ENT was very, very positive as far, I was in good health. I was not young, but fairly young. My chances of survival were very high. But you think, I could die. I got my financials in order. It just makes you think about things. I was just very impatient to be done. Because it's not a big deal, but it was a drag. At noon, I had a date with the hospital. And then, of course, when I had to change facilities at 8 a.m. before work, I had a date at the hospital. It's not terrible. And I suppose if I was told, you have to come in for 10 weeks, I'd be okay till week 6 maybe, and then, but you just get tired of it. Dry mouth to some extent, but again, after advice from a fellow patient, I drank a lot of water. So, and partially to make myself feel full, but also just to prevent having that dry mouth. Of course, with the tube down your throat, it's not comfortable, but again, being compliant and a few minutes of discomfort. I want him to see my throat. I want him to see that everything's okay. And that's, again, it's just a little discomfort. My partner, who is now my wife, it was really the best. After my biopsy, I was told, and I'm a talker, you can't talk for 2 weeks. So it was rather nice that someone else had to let people know what was going on in my life, because that was the first time I actually said that to someone. It was difficult. And of course, at that time, that was pre-treatment. I didn't know what was going to happen. I didn't know what to expect, but just everyone was very supportive and very caring. They were great. We became almost, not a family, but when you go someplace at the same time, and the way the hospital, at the main hospital, it was a small waiting room, and there were usually at least 1 or 2 other people there, and you talk, the best you can. Some of us had a little trouble, but it was that, and again, it was good to have an appointment at the same time. It was that continuity, and then seeing familiar faces, and to be supportive to each other, because that's one thing that I've learned as a patient advisor with other head and neck cancer patients. We are unique. No one, people can empathize, but until you've been there, you don't know what it's like to have cancer. And it changes your life. It's not going to be my life, but it definitely is a factor. It's something that's part of me now. If you have concerns, make that appointment. Don't self-diagnose. I don't think those mail-order medical degrees are available to us these days. So if you have questions, follow up. But I remember walking into the clinic the first time, and they had a sign, and it said, "Every day is a gift." And I think that stuck with me. I think I've always been an optimistic person, but I think that's one thing that, I don't wish anyone to have cancer, but I think it really puts things in perspective. Every day is a gift, and living every day to its fullest. I think that I think I could have been taught this lesson a different way, a little easier, but I'm still appreciative that I'm here, that I have learned the lesson. And now, as a patient advisor, knowing other cancer survivors, I'm appreciative of the care that I've received, I think.